Hello everybody, I'm Susan Collini and welcome to our monthly and May Flowers Roundtable. And I'd like to introduce our team for today. We have a little abbreviated team today. Can everybody see Sarah? Did you get yourself in there?
Yes, I should be.
Okay, to my right, your left is Sarah, who is our Age of Innocence manager, and she is also our guru to social media and all the other things that go with it, our digital guru. To my right, next to her is Ronnie. Ronnie's chief cook and bottle washer. So everybody's got these great titles here.
Yeah, right?
Right.
I just get into everything around, so you'll see me across the board. Yeah.
And to my left is Ashley, who is one of our nurses. And say hi to Ash. And Ashley graduated this.
I'm official.
Yeah, she's official, so she's licensed and everything. So we're really excited. It's been a long road, but we're really welcome all of her expertise and her help in our organization.
It's exciting to be official now. It's part of everything.
So, topic for today is Skin Cancer Awareness Month for May. So we're going to be talking about melanoma. Skin cancers. There are different types of skin cancers that I know we've done this segment a couple of times. I think we've been doing our roundtable for 3 years, so this might be
COVID
the third
was
one.
Our start.
Yes,
Yeah.
we started in COVID. So you've heard us say this before, but we can't ever say it enough. There's not enough education that we can impart with that doesn't help remind everybody, because we get busy, we get on our daily stuff and we forget about it. But it's very important to take notice about your body and the little marks that you see arise. And unfortunately, as much as we love the sun and we love to be at the beach and the pool and all those good things, there is a negative side effect. So that's the one thing we like to talk about, that some of us, like at my age, we didn't know all the damage when I was young, all the things that could happen. So we set out with baby oil and iodine and vinegar, you name it, anything to attract the sun, and all these oils that we would put on. And I'm sure that people of my generation really, really have some sun exposed, some damage. So but this is a reminder for everybody, because I see a lot of young people come into our practice and they aren't, they should be aware. We know this stuff now, so there's no reason to not protect yourself. There are so many different types of sunscreens and so many different products that you can use to help prevent that. So we are going to get into that in a minute, but we want to stay on the clinical aspect of the ABCs of melanoma and skin cancer. So the first thing that I want to say is that there are ABCs. So you can look them up. You can find it in Google. Yeah, Google. Acronyms are always my weak point. So, but the first one, A, is for asymmetry. So if you see a mole or something that looks like a mole and it's in a regular spot, you're concerned about it, that's a reason to go see a dermatologist, a plastic surgeon, somebody that specializes in skin, and just get it checked. I mean, it doesn't hurt to get it checked. Keep an eye on it, because they're very easy to take out in the early stages, but they can do some really big damage. I mean, we know that we have basal cell cancers, we have squamous cell cancers, and we have melanoma. So those are your three big types, and they all have different outcomes. So it's really important to be on board with this. The next thing is border irregularity. So if something looks like it's coming in and out, and it kind of looks like a map, it's another thing to give you a clue that there's something that's not quite right about border. Ronnie, what about the next one?
So color. So a lot of people, I have a bunch of little lesions, little moles all over. So looking for just differences in color. If the outside's really pale and the center's really dark, that's cause for concern. Different things.
Called a fried egg.
Fried egg, more or less. Yep, exactly. So something to watch out for sure.
Well, brown spots now, people get confused with brown spots. So unfortunately we get a lot of sun damage, and we can have melasma, we can have sunspots. that aren't cancerous. They might be unsightly, but there are treatments to that, and we in our center do a lot of correction. You know, we can do the IPL for lasers. We can do retinols and glycolics to help address brown spots. But when brown spots take that next leap or whatever, or you never know if it's a brown spot or a mole, come in. You know, we all know that you're not doctors and professionals, so, but better to be on the safe side again. So color is very important, and the darker it gets, the more concern it gets. So please be aware of that. And then if they're two-toned, that fried egg look where the center is dark and the outside is light, you know, that you've got that change, that's something to look out for as well. The next thing is the diameter. So the size is very important. Anything over 6 millimeters, which is about 1/4 of an inch, should definitely be a reason for concern. And even if it's maybe a preliminary stage, the larger anything gets, the harder it is to remove in the long run. So you want to get it in the early stages as soon as you can, so that the reconstruction aspect of taking something out is less noticeable, more manageable, and that's one thing that we really hope. I mean, the two of you, I'm going to let each one of you have a minute here to talk about it. You actually are with Dr. Collini at taking out moles and lesions all the time.
And I think that's something people often forget. You know, they think plastic surgery. They're not always thinking that we're doing, you know, sometimes a reconstructive thing for skin cancer or melanoma or something. So doctor can identify something like that, and he can do the proper type of procedure to ensure that the whole entire thing is taken out, that our margins are most likely going to be negative, and we get the skin and the healing to be proper in that area.
Right. So there are a couple of different ways to address skin cancer and to excise it, but I know that dermatologists use what's called Mohs surgery, and that's a different technique that plastic surgeons don't usually use, but we work hand in hand with the dermatologist. So the Mohs surgery is where the physician is trying to get all clean margins, but as tightly as he can. So it coincides with a pathologist being there to make sure that, you know, all of the skin around the lesion is clean before it comes out. And sometimes that they can heal by internal retention, or how do they call that? There's a term for that. Secondary retention, yes. Where it just kind of heals from the inside out. But a lot of times you might need closure, and in that case, if you need closure, then they would see a plastic surgeon to do a special flap or you know, some type of tissue rearrangement or something that can fill in the void that the lesion has left.
But I would say most of the, you know, the lesions that we do see, it's not quite that even invasive procedure. Most things we are able to do in the office here. It's a 20-minute, half-hour procedure. We excise it out and we send it out for pathology. And, you know, we have those results back in about a week, and we can go over those with you, and we know what's going on.
And for the most part, insurance does cover them. I do like to mention, though, unfortunately, that there are kind of rules about insurance, and we take out one at a time. It seems it's very hard sometimes for patients to say, I have to keep coming back because I have so many moles. But we want to be able to make sure that, you know, insurance does cover them for you, so we have to fall within the guidelines, and that they're 2 weeks apart. We can't take out multiple lesions that close together. So there are some restrictions that your insurance company may have, and we try to make sure that that's all covered for you. So there's no reason for you to come in. Sometimes people think that moles are for a beauty mark and that it would be cosmetic. It really isn't. So they usually are covered by insurance. So please, you know, do your due diligence.
And again, something doctor's going to take a look, and if it's something he finds concerning, you know, he's going to take it off. And there's been occasions where we've taken a lesion off and weren't thinking it was anything, and it was definitely something. So it's better to get it checked.
Yeah, I actually had one taken off. It was quick, painless, and I'm glad I got
we do it right in the office, so it's not a big deal. Now,
so it's comfortable.
I mean, sometimes when they get larger, we do have to take you to the operating room. Sometimes people let them go and they're really invasive, so we want to get it to before that point. So, So the very last thing about the ABCs, because it actually goes to A, B, C, D, E, not just stopping at C, is the evolution of the lesion. So that means, is it changing? Is it itchy? Is it bleeding? Flaky? Is it tender? Anything else that you
Is it
hear?
bleeding? Some people, they'll get a lesion like, once it bleeds once in a while too. I mean, that can also be a cause for concern. I guess things aren't supposed to do that.
And sometimes too, like people will say, like I had a few people come and they had like a lesion there, it was itchy, then it would kind of go away for a little bit, come back, like you said, start bleeding. Like, so those are all things you want to watch out too. If it's constantly changing, that's a sign you should probably come in and get it looked at.
Of course.
Right. So, I think we've scared everybody enough.
Yeah. If you're worried about one, come see us.
Yeah.
That's it. This is
Come and get
just
it
one of
checked.
those reminders. So this is what our roundtable is a reminder to do your due diligence. And if you are out in the sun, please use sunscreens. There are all kinds of great products on the market. Of course, we have our own. We have them right here in front. I'm hoping that Sarah was staging us here. And I'm hoping that you're seeing those
we can
products.
see them. I can.
But I'm going to turn that over to Ashley because she's the product guru since our Derek isn't here today.
Yes.
And hi, Derek, if you're watching. And so, Ashley, I'm going to give you the sunscreens that we have and have at it.
So the nice thing about our sunscreens is that we are a pharmaceutical-based company, so the nice part is they're medical grade. What you find in the drugstore sometimes is not as strong or as full broad spectrum UVA protected. So ours have zinc in them, which is very important because that's going to give you a full block. It's going to cover more broad on the spectrum. So therefore you're going to have, less damage. We always want to keep reapplying it too. A lot of people who are out in the sun constantly, they think they can just slap it on one time in the morning before they go out. They're sweating, they're swimming, and then they don't reapply it, and that's when the damage can creep up because they think it lasts all day. It doesn't. Make sure you're applying it every hour, 2 hours. But with ours, we have a couple variations. So we have just a regular SPF 50 for the face is always good. 50 for the face or 45 even, and then at least 30 SPF for the body. But we just have a sheer sunscreen, which is really nice. It also has some moisturizing properties in it, which is good to give you some hydration over the summertime when it's warm. We also have a tinted version if you are someone who likes to have a little bit of coverage, like Susan, myself.
It's my favorite. It's my favorite.
I love to have a little bit of coverage too, especially on the beach. It is buildable. It's not anything that's going to be super heavy. It's very lightweight. You just put a little bit on. It is buildable, so if you did like a little bit more coverage like I do, you can put on just like maybe a little tiny bit more, but it's really great to just go out and just have that minimal makeup look but still having some coverage on and you're protected. And then moving on to our body spray we have there, which is really good for the summertime, especially if you're at the beach, the pool, the lake, outside doing yard work, gardening.
For little ones, like
little
Sarah's
ones,
little guy, Luca. Yes, to
safe
spray
for
because they don't want to stay long enough to have
Rub
everything
it.
rubbed
Just
on.
spray with
So the
spray.
sprays are
Or
really
if you're
nice.
me, because I
Yeah.
got it.
I know,
Or
it's
if
so
you're a
much
doctor
easier.
who doesn't like any cream on
Yes.
his
Yeah, I
hands
don't
at
like
all,
that.
the sprays are
And that's
fabulous.
the thing, the spray is nice and lightweight too, so it doesn't
It is.
feel like you're super oily or heavy. Like it does go on nice, the skin. It does have a nice scent to it too. And it's nice when you're on the beach, you don't have to worry about like getting your hands all oily in sunscreen. You can just all over the body. And then lastly, we have, which is really good, which kind of crosses over to the doctor's side, is we have a scar gel, which is really important when you're bruised or scarred if you had a procedure done. Not only lesions, but also cosmetic procedures as well. If you have a scar somewhere that's noticeable, especially like sometimes with abdominoplasties, if you're, in a bathing suit in the summer, or if you had a lesion removed, it's always good to protect your scar too. And that has an SPF 45 in it, so it's gonna help hydrate the scar, but also protect the scar from the sun and help the healing process along too. So we got a good plethora of sunscreens for you guys.
And actually, that is like my go-to
Yeah.
product. I use that as a primer before makeup, and it's just like a
Nice
slick
texture.
Yeah.
silicone. Like
Yeah.
I like it. Gives you a little dewy appearance. So our products do a lot of different things that we've
Yes.
our little girl secrets, you know, about how to get the maximum,
Yes.
you know, use out of your product. So you're not using 5 products to do something that you can pare them down, you know, and get a lot of things out of one product. So I love that.
And that's nice too, because you mentioned like the finish. So we do have some sunscreens that are a matte finish. So if you're like one of the kind of girls that just like a nice clean matte look, that's sunscreen that we have. Then we also have one that's for a more dewy complexion. So just depending on what you like. I'm personally a dewy kind of girl, but I mean, depending on your finish, whatever you like, we have loads of sunscreens for you guys to choose from, but they're very, very good.
The other thing is about sunscreens that people don't realize. So many times you go in your closet from the year before and you have something from last season. Get rid of it. You should have fresh sunscreen every year. Every season you should replenish your sunscreens and get something new, because the one thing about sunscreens, and I'm not one, my kids yell at me because I save outdated products and foods and things like that. But there are a lot of things that you can do to keep beyond an expiration date. But sunscreens aren't one of them. Yeah. Sunscreens are the one thing. They really do lose their effectiveness quickly. They're not bad. They just aren't as effective. And you want the most effective UVA, UVB protection that you can get. So, discard anything from previous seasons. It always, like, you cringe because you pay a lot of money for good sunscreens, and you throw them in the waste paper basket, but you really need to get rid of them before the new season starts.
Just lather yourself up.
And actually, that's the one thing I want to bring up, because we're going to go into our specials for the month. So this is the good time to buy sunscreen. So for the month of May, in order to pair with Mother's Day coming up, which is May 14th. So remember, everyone, your mothers are very important. So we have some specials we're going to mention. But the sunscreens this month are 20% off. So any of these great sunscreens, it's really the time to buy them and put them in your cabinet and use them for the season. That's very important. So, it gives you a good reason to get out and pay attention to your Cancer Awareness Month. Again, this is Skin Cancer Awareness. The other cancer is in October, but this is Skin Cancer Awareness Month. So now I hinted with Mother's Day. Our Mother's Day special that we are having is, I think, a combination blowout and microdermabrasion, which is only $100. And that is a really good deal. So mom can get her skin resurfaced, and if she's feeling like, oh, I can't go out because I got my hair a little mussed, we'll have a blowout in combination with that. So it's a really, really nice special, and we all want to thank our mothers and do something special for them. Obviously, we have a whole host of 25 other type of services that you can choose from, but that is our special for the month.
It is.
And at this point, I think I just want to check in and see what you guys are doing for your mothers.
I know we're going to a brunch, so that'll be my morning. For Mother's Day. After my birthday.
That's right. Ryan's birthday is next month.
Next
week. 8th, isn't it?
11th.
11th. Oh, sorry.
That's all right.
It's next week. I didn't know it was next week. That's a good thing. So a celebration twofold, mother and son, right?
Yes.
And Ash, what are you gonna do?
So probably, like, my mom just loves to sit around at home. She loves our deck that we have outside, so we can put our sunscreens to the test. And then maybe have some mimosas outside. Hopefully the weather's good. Maybe do a little planting, some flowers. She likes to do that stuff too. So have a nice day at home. Maybe some breakfast.
Plan something special. That's it. And I know what Sarah and I are doing, because we're doing it together.
We're going to brunch.
We're going to brunch with the family and the kids. So we're all excited, and hopefully we arranged it around baby's sleep time this year. So we'll see. It will never work itself out, because we think we're going to do it, and then it messes up.
Kids make their own.
That's it.
Schedules.
So I think we've said enough for today.
Yeah, I think.
And our next roundtable will be June the 7th, and that is, believe it or not, the first Wednesday of June. So it's actually it's crazy, I know. So we haven't picked our topic yet, so I can't give you a sneak peek of what's going on.
It's a surprise.
It's always a surprise. It's always a surprise, but hopefully we'll have something really exciting to talk about. and we will see you June the 7th. Take care, everybody, and happy Mother's Day to all those moms out there. See you later. Bye now.
Bye.